very happy that every year from 1st to 7th August, the world observes the World Breastfeeding Week to celebrate the power of mother's milk. And this year, the theme is the breastfeeding for a sustainable start in life and strengthens what works. This reminds us small, consistent support system create the biggest impact. So we all of us know the breast milk is nature's first vaccine. Breastfeeding within first hour of the birth is called the golden hour, which is significantly reducing the the neonatal mortality. Exclusive breastfeeding for 6 months builds the foundation of immunity, nutrition, and emotional bonding. And it's not just a nutrition. Breastfeeding lowers the mother's risk of postpartum hemorrhage, breast cancer, and ovarian cancer. As doctors, families, and workplaces, our role is to strengthen what already works, skilled lactational support, paid maternity leave, and judgment-free environment for the mothers. So every mother deserves the accurate guidance. Breastfeeding difficulties are common, but they are almost always solvable with right support. So sustainable start in a life daily begins with the supported, informed, and confident mother. And this World Breastfeeding Week, it's pledged to protect, promote, and support the breastfeeding. Thank you so much. Today, I am very happy that we are having our own Dr. Seema Vijaywargiya. She is the director of Shakuntala Devi Hospital, and she is the experienced 45 years of practice in OBGYN, hard, honest person. And she is now at present president of Indore Menopause Society Indore and past president of Indore OB-GYN Society. She is a coordinator of Sangini Breast Cancer Support Group and has special interest in high-risk obstetrics, prevention and awareness, menopause treatments, adolescent education, and breastfeeding, counseling, promotion, and support. And the most important, she is the lactational consultant, one of the very few lactational consultants of the country, and she is having that degree with her. And she is being awarded with many influential women in the Indore as many awards she is having. So, and the best part is we have a very good relationship with each other. She is just like my elder sister. So, welcome, Seema Didi, for the grant.
Today we are going to talk about the obstetrician's role in promoting breastfeeding. Why we are talking about this thing? Because this breastfeeding is one of the most important and effective intervention of for the patients and for the baby for improving maternal and child health. But in our busy obstetric practice, what happens that we are aiming towards a safe pregnancy and a safe delivery, and the most important part of breastfeeding is usually overlooked. So it is very important that the reality should be understood by the obstetrician so that we can give a good healthy start to the newborn, and it is our duty to do this because the influence of obstetrician on the patient is the most important. So it starts with antepartum support. So you have to address the queries like, will I be able to breastfeed? Will I have enough milk? Will it hurt? How long should I continue? Will my partner help? What are the preparations for breastfeeding? What will happen when I join work? This is the most important thing because most of the girls are working these days. So in antepartum support, the breastfeeding consultation should always be there. We should take out some time for our patients to prime them up for breastfeeding. So antenatal priming and postnatal support is the part of a routine management. And if we give them a pamphlet, only written information is not sufficient. So the aim is to give a written questionnaire and the test of the knowledge should be done. This should be done around 32 weeks. This is necessary to assist the primary para especially, because they're inexperienced. And in this process, we should involve husbands, mother-in-laws, and mothers, or any other attendant who will attend the patient or the baby. And at the same time, we should be ready to assist in breastfeeding difficulties. Most of them are avoided if the mother is well informed in advance. So then comes the intrapartum support. As antepartum support is important, intrapartum support is equally important. Encourage mother for normal vaginal delivery. Minimum use of painkillers should be done because it depresses the baby. The baby should be kept in skin to skin contact immediately after birth and even before cutting the cord. All other things can wait, but the baby should be kept on skin to skin contact. Ask the pediatrician to examine the baby on the mother's abdomen. Avoid unnecessary oral suction if the baby is fine. What is skin to skin contact? The practice of placing the naked baby on the bare chest of the mother and covering the baby with a dry sheet on the back is skin to skin contact. In this, the baby's head should be covered lightly with a cap so that the heat loss is minimum. It forms a cocoon or a pouch or an envelope. The baby becomes the center of the mother's world and the mother becomes the baby's world. So, this is a very beautiful phenomenon by the name of breast crawl. It is a reflex of predictable sequential pre-feeding behavior and the movements of the baby's body to reach the breast. When we put the baby on the abdomen of the mother, there is a crawl, and the crawl is the baby uses his legs, hands, and bobs his head to reach the breast because he understands that this is my mother. He knows the smell of that milk, or because the milk smell and amniotic fluid smell is a similar. So this baby crawls on his own towards the mother's breast, and it may take 50 to 60 minutes to reach it. And this is a clear imprint on the baby's nervous system, which positively affects the organization of the brain in future. So this is what is happening in the labor room. But postpartum support is also very, very important. Here we can talk about the first golden hour, Pehla Sunehra Ghanta. It is very, very important because the baby is in active and alert stage or quite alert state of arousal in the first hour of the birth. In the first hour of the birth, the sucking reflex is very strong, and breastfeeding should start in the first golden hour. During this hour, the baby should necessarily be kept in skin to skin contact with the mother, and this facilitates feeding as soon as after birth, which helps to build a bond between the mother and the baby and facilitates breastfeeding for a long time. Unfortunately, only 37% of the babies get breast milk in the first golden hour. So, next comes the rooming in. Co-sleeping is very important. Usually we see in big hospitals there are curtains besides the patient and bassinets besides the patient and the baby lies in it. That is not the correct way. The baby should be in skin to skin contact or should be near the mother as long as possible. So uninterrupted skin to skin contact is very, very important. This helps in less crying, and the infant arousal is very easy. It improves the breastfeeding, it improves the baby's sleep, and it has been seen that mother's sleep is also unchanged when she's with the baby and she's breastfeeding the baby. The mother responds to the early cues of the baby, and mother is very confident that she will be taking care of the baby. Baby also feels very secure. When the baby is kept in skin to skin contact after delivery, also there is a stabilization of his pulse and heart rate and respiration also, and warmth of mother travels to the baby, and the baby feels very secure And all the stress of the labor goes down, the cortisol becomes less, and the baby is very comfortable in mother's lap. So this is what is we can do in the labor room before and after the delivery. Now the importance of the colostrum should be told to the mother in early antenatal period only. It comes in initial 3 days. It is a nutritionally dense protein filled with immunoglobulins and very small in amount, low in fats, but easy to digest. It is salty in taste, high protein, as I said. It has a lot of others also. This is called as first vaccination of the baby because even small amount of the colostrum lines the gut of the baby in a way that the infection doesn't pierce into the intestine of the baby. This prevents allergies also, and when it is given in the early days, it prevents all other chronic diseases also in the life to come. This this is a purgative action. This has a purgative action, and it clears the meconium as soon as possible and saves the jaundice to rise up. So colostrum is very important, and there is a myth in many people that it is a dirty milk and it should be thrown. So this should be told to the patient from the very beginning, to her attendants also from the very beginning, that that has to be taken always. Even in premature babies who cannot suck, we usually ask the mother to take out the colostrum and give it to the sister so that she can paint that colostrum inside the baby's mouth, and that also gives a lot of benefits to them. So usually the question is, the baby is crying all the time because inside the womb the baby has not to do anything for the feeding. It is getting it directly from the mother. But when it comes out, it has to work hard for passing motion, passing urine, movements of the hands and feet, and also feeding. So he gets very much tired very soon, and even when the baby is put on the breast, there are pheromones in it, and there is a very good smell in the breast milk that puts him to the sleep. And when mother thinks that he has done his job, and when she keeps it on him on the bed, the baby again gets up. So the presumption is that the baby is not getting enough milk. But in this respect, we must teach the patient that the newborn stomach is very small. On day one, it is the size of a cherry. So even 5 to 7 ml of milk is enough to fill it up. On day two, the size of walnut is there. After 1 week, the size of an apricot is the baby's stomach, and after 1 month, it becomes the size of a large egg. So in that case, the baby starts drinking 80 to 150 ml at one go. But in the initial week, the baby will be drinking very small amount, and because it is nutritionally dense, so he gets all the energy. But people think that the milk is not coming, and so the baby will be hungry. So this should be told to the patient in antenatal period as well. Now, we must understand what are feeding cues. Cue is the baby is giving you an indication, ishara. So there are early cues, mid cues, and late cues. In early cue, the baby only informs you that I'm hungry by stirring his head, mouth opening and turning head and seeking for the breast, that is rooting. And if you recognize this early cue, then the breastfeeding is the best. If the mother ignores this early cue, then there is a mid cue where the baby is telling you that I'm really hungry. Baby stretches his body, it increases the physical movements, and he puts his hands in the mouth. And mother should at least recognize this mid cue and start feeding them. But if this is not seen or ignored because the baby is lying in some cradle or something, so the late cue starts. The late cue is when the baby starts crying. If the baby is agitated and the color turns red, and then the baby doesn't, if you put the baby to the breast, the baby will not have the breast milk. The late cue indicates that please calm me and then feed me. So these are the cues which should be told to the mother at the time of the birth, after birth, or before in the antenatal period, so that she also understands what it is and why this is important that the baby should be lying with the mother. So the skill of the breastfeeding should be taught to the mothers. And the skill of the breastfeeding basically are good latch, proper holds, and correct positions. The mixture of all these things will lead to a successful breastfeeding. The practices which should be avoided is separation of the mother and baby. And secondly, washing the body odors. Like many mothers think that if they wash their nipples, it is always healthy. But they should be told that there is a thin film of milk on the nipple which prevents the infection from going inside. And so if you wash the nipples, you are actually disturbing that film. So, and third thing, which is very important, and our pediatricians always do suction, even if the baby is crying loudly, even if there are no secretions, because that is out of their practice. But it is said that if it is not necessary and the baby is crying vigorously and there is no distress or he's taking good respiration, then suctioning is not important, not to be done actually. Not importantly, it should not be done because it gives a trauma to the baby's mucous membranes. This is a picture of latch, and latch is very, very important. In this, usually you can see that the mouth angle is 140 degrees. Both the lips are flanged out, and the mouth covers the areola. In the lower side, the areola fully goes inside the mouth, but upper areola is seen in small amount. The baby's chin is touching the breast of the baby mother, and the head is slightly tilted back so that it is very easy for the baby to take a respiration. We usually think that if we don't hold the breast in a V-shaped manner, the baby may not be able to take breath. But in a correct latch, there is no such thing, and this should be told to the mother always by the obstetrician. Then comes the position. There are many positions in which the baby can be fed, and it is only for the initial few days, because in initial few days the baby doesn't know how to change the positions and all that. Once he gets rampant with the breastfeeding, then it starts taking milk in any position. But these are the three main positions which are very common, and the laid back position is the most important and most common and most used uh, method, in which the mother is also resting and the baby is also resting. In sitting position also you can feed the baby, and the best position is sideline position, because in that the mother is having rest. If she is having a normal vaginal delivery, then her perineum doesn't hurt when she's lying. And if she's having a cesarean section, the baby is not hurting her abdomen or the stitches. So all these positions are important. But in all these positions, you should see that the baby is positioned in a way that the ear, the shoulder, and the hip bone is in one line. And this applies to each and every position when Kan, Kandha, and Kula, they are in one line always. This will happen only when the baby's abdomen is touching the mother's abdomen. The baby should always be facing the mother's abdomen. And in all these positions, you can see that the baby is facing the mother's abdomen. Thirdly, it has been seen that the positional stability is very, very important. So a hand should be kept on the back of the baby so that the position which has been taken is stabilized and the baby is very comfortably having the milk. Fourth thing is, nobody should ever hold the head of the baby, because when the baby takes milk, it extends the neck slightly behind. If you hold the neck head, then there is a flexion, so it is very difficult for the baby to take milk. So in all these positions, these principles are met with. The baby is facing towards the abdomen, the ear, the shoulder, and the hip bone is in one line. The positional stability is done, and baby is on the breast. It is also very important that how to hold the breast. That should also be taught to the mother. It should not be held in a V-shaped manner. It should always be held as a burger and not like a scissors, because we are doing a breastfeeding and not the nipple feeding. If we stretch the nipple and put it in the baby's mouth, that is nipple feeding. But we want that baby should take all the areola inside, as you saw in the latch. These are the holds. Like I told you, latch is important, the position is important, and these are the holds. The holds are also very important. These are whatever is convenient for the mother, she can do it. There is one cradle hold when baby's head is in the hook of the elbow, and of the same side. The baby's head and the head hand from the same side is holding, that is cradle hold. Cross cradle, the other hand is holding the baby's head or neck and feeding the baby. Sideline hold is as it is in sideline position, and there is a football hold in which the baby is in the axilla of the mother and lying in the legs are behind the mother's back, and the baby is comfortably taking this milk. Football hold is very good for twin deliveries also. Both the children can feed at one time. So there are some problems which affects the breastfeeding, and when there is a problem and we pass the judgmental comments like आपका nipple तो बहुत छोटा है या flat है, so the patient gets disturbed. If he say आपको तो दूध नहीं आ रहा है, the patient gets disturbed. So all these things should not be said. We should always promote breastfeeding and ask her to do it without passing any judgmental moments. So there is a nipple diversity. In normal nipples, we can see flat nipples are also there, inverted nipples are also there. But it is very important to tell her that it is not a nipple feeding, but a breastfeeding, and the areola, if goes inside, then the baby can be fed in inverted nipples also. There are certain problems which come in the way of breastfeeding, and because there is a lot of milk which is forming, but the baby is not able to suck out that much of milk, so there are problems of engorgement of the breast. The engorgement is usually painful, but there is no infection in it, and because of the pain, the mother's breast becomes very heavy. That is one problem. If one of the duct gets inflamed, then there is mastitis, and if not treated or not resolved properly, then it may form a breast abscess also. So we should know what is reverse pressure softening. Reverse pressure softening is for engorgement of the breast. In this, we ask the mother to rotate the arm. The arm movements usually facilitate the lymphatic drainage, and then gently push the lymph towards the axilla, and then MER should be elicited. MER is what? When the fourth intercostal nerve, which is traveling from below the areola, is stimulated, then there is a oxytocin release from the brain, and it starts the expression of the milk. So whenever we have an engorgement of the breast, we should ask the patient to lie down. We should do a reverse pressure softening by pushing towards the chest wall, pushing towards the axilla, and then squeezing the breast tissue and removing the milk. And empty the breast, and then immediately put the baby to the breast. Or other things which I talked, mastitis should be given some anti-inflammatory, but even if there is the breast abscess, the mother should not be subjected to the incision and drainage. Nowadays, they are doing it with a single duct is having a breast abscess, so they remove it under sonography with a wide bore needle, and the baby continues to drink milk so that the usually what we used to do in earlier days is we used to give them some medicines to stop the lactation. That is not the practice these days, and we usually do a localized removal of the pus from the breast abscess. So, what are the top-up traps? Why mothers get caught into it? What is top-up traps? Top-up means top up the milk. So, because they are not understanding the importance of breast milk. The breast milk is very, very good for brain development of the baby because there are certain factors in it, certain oligosaccharides in it, certain uh, proteins in it, which is important for the brain development, and the fat content and the lactose is very important in the mother's milk, which is responsible for the brain development, for the body development, for the immunity and everything. So we have to make them understand the importance of breast milk for the baby and the health benefits of the breast milk for the baby and for the mother. The most important thing is the babies who are breastfed for 2 years, exclusively for 6 months, have less chances of getting chronic diseases. So it is a very good thing which we can tell it to the patient, and she should understand that. And the benefits to the mother are, as Dr. Kavita has said, that it is good for fat loss, it is good for not having breast cancer in future, and also it gives a lot of satisfaction and confidence to the mother. This also happens because they're not understanding the concept of stomach capacity, which I said already. They think that this much of milk, 1 teaspoon of milk, cannot fill the baby's stomach. But they should be told about the capacity of the baby in the early days. And every cry of the baby should not be taken as a hunger. So one should not think that if the baby is crying, then he is hungry. Especially mothers worry about the initial normal weight loss. It happens in first 10 days, and more than 10% of loss is important, but in a normal individual, normal baby, it doesn't happen that much. There is one trend which is going on these days that after 2 hours of baby's birth, usually the blood sugar is done of the baby. But it should be, when we read the physiology, there is a nadir after 2 hours in baby's blood sugar. So every baby is having a low sugar. And this is told to them that their blood sugar is less, and the mothers get fearful, and they start then on the top of fluids or milk or formulas. But that is not true because every baby is going to have that nadir, and they say that uh, if the blood sugar is below 35, then it is real hypoglycemia, not before that. And if it is there, then the baby should be given glucose rather than the formula feed. So this should be known to the pediatrician and also to the obstetrician. She should say no to top up things and say that if the baby is having a less blood sugar, please give them dextrose rather than giving them top ups. Also, the mothers are very much worried about the development of the physiological jaundice. They should be told that more the baby feeds, more easily the meconium is removed, and the mature milk. When the mature milk comes, the color of the motion becomes yellow. So physiological jaundice is less, and physiological jaundice is there with every child. But if the meconium is not passed very properly, then the jaundice is more. So it should be told that it is very important to have less jaundice. People are worried about C-section also, but they should be told that even if the baby is delivering by C-section, the rules remain the same of first golden hours, skin to skin contact, starting to feed, and all other things are same, and the staff is there to help, provided the obstetrician is there to tell that we should be starting the milk secretion, milk feeding as early as possible. There is one more condition of growth spurts, or when the baby starts cluster feeding. The baby is feeding every half an hour, and the mother thinks my milk is not coming. That's why the baby is demanding every half an hour. But we must understand and make them understand that there are periods of growth spurts where the baby is going to demand this for a day or so, and then it becomes normal on its own. So and there is one more thing. Whosoever will come will say, हमारे तो इतना दूध आता था, आपको ज्यादा नहीं आता है क्या? That very sentence, or the staff saying this कि दूध कम आ रहा है, that very sentence really strikes the psyche of the patient, and she starts worrying. So worrying will definitely decrease the milk secretion. She's also worried about the flat or inverted nipples if someone passes the comment. Then she should be told that it is not the nipple feeding and it is a breastfeeding. So we should know what are the risks of formula feeding. Usually, we say that breastfeed is the best feed for the baby because it helps in brain development. So the babies who are on formula feeding, they have more diarrhea, they have more respiratory tract infections, they lack the balance of nutrients which are responsible for brain development. They have more allergic conditions and lactose intolerance in future. They are at the increased risk of chronic diseases like diabetes and blood pressure. They usually are overweight babies and look very chubby and sweet, but their immunity is low. And their IQ score is also lower than the babies who are breastfed. So, looking to all these infections and all that, there are more mortality rates because this milk is not that easy to digest. It requires preparation, and in the process of preparation, there are infections. Also, it interferes with the bonding. So, let us see what are the barriers to breastfeeding. Why people are not going for breastfeeding? From our side, we should always talk to the patient and allow her to make her own decision. But I'm sure that after listening to all the benefits of the breast milk, the female wants that she should breastfeed her child. But it is the paucity of time with the obstetrician which is leading to barriers. Like early discharge from the hospital, no follow up after 1 week, lack of postnatal support to the patient, and sometimes it is maternal attitude also. There is societal pressure also that the milk is less. Sometimes it happens that the working mothers are not able to cope up with milk supply of the babies. Very premature babies or NICU admissions also are not getting the breastfeeding properly. So in 2023 World Breastfeeding Week, they had a motto that enabling breastfeeding and making a difference for working parents. And that is very important, but because more and more girls are going for work. So let us make breastfeeding and work. Proposed facilities for breastfeeding for mothers at work are Maternity leave till the baby is exclusively breastfeeding, that is 6 months. A break allowance for mothers to express milk. Provision of a clean, warm, private room, not the toilet, for expressing milk. A secure, clean fridge to store the expressed milk. Flexible working hours for breastfeeding mothers, and provision of creche in bigger units. Feeding with express breast milk is good. It is very traumatic, and it is highly emotional time when the mother is leaving for work and leaving the infant to go to work. Feeding with express breast milk connects emotionally despite a physical absence. It helps to avoid acute and chronic illnesses and make the breastfeeding very special when they are close. It can be done by either hand expression or pumping. When to start pumping and storing it? If you are going for a work, then at least 2 to 3 weeks before going to the work, you should start pumping. And this express breast milk can be stored for emergencies. It helps to figure out how to feed the baby either with cup or bottle. It helps calculate the amount of milk also per feed, and during travel, it can be stored as a frozen pack. So every obstetrician should teach their patients how to hand express. Because sometimes what happens, the patient just pushes the breast like that and she says, बहुत कम दूध आता है, because she's not using the correct technique. So we have to tell them that start by holding the breast with finger and thumb cupped around the breast in the C shape and not touching the areola. Press finger and thumb backwards towards the chest and then compress the breast between finger and thumb, moving slightly towards the nipple. Release without removing the hand from the breast. Repeat this movement of the hand around the areola in order to compress all the ducts. So the hand should rotate from one position to another position so that we are utilizing the milk from all the glands. So this should be taught to the patient. Pumping can be manual, it can be electric breast pump, but the best thing is while working also she can have a bilateral pump which can be fitted inside her inners, and she can collect the milk while working also. Now coming to the storage of the milk. If she is pumping, then storage should be very hygienic. Storage container should be clean and boiled every day, preferably stored in the same container which is used for the expression. Store in a way to maximize nutrition and anti-infective property of the milk. Milk, it can be used on a room temperature at 22 degrees for 4 hours if it is kept outside. But if you want to use it afterwards, then it should be refrigerated and can be used in next 12 hours. But milk can be frozen. For freezing milk, first cool the milk, first chill it, and then chilled milk can be frozen. It can be saved for 3 to 6 months. And every container should be labeled with date and time, and accordingly, the mother should use it. The container should not be filled till top. These are very small things but should be told to the patient. Milk bank is a good concept, also known as a lactarium. The milk bank expands the safe use of human milk for all the babies, especially premature, ill infants and babies deprived of mother's milk due to maternal factors. It collects, screens, processes, stores, and dispenses milk to the needy. A movement by the actress Neha Dhupia was taken up, in which she was speaking about donating milk. And Janki Parekh, a professional singer and a voice over artist, and Jwala Gutta, who is a badminton player internationally, she represents India. They joined this movement, and Janki Parekh herself donated 90 packets of milk. And this is very useful for the premature babies, because they say when there is a premature baby, one should always, first preference should be for the mother's milk. Second should be other mother milk. And third from milk bank. So the milk of all the human beings are same in protein content. So anybody can donate for any of the child. So one more thing, breastfeeding in public. This is a most talked thing because they have shown some pictures that some parliamentarian is feeding the baby in the parliament. But that is possible because one third of the breastfeeding mothers are forced to use toilets to express milk at work. And 25% of the women feel that it is inappropriate to feed in the public because breasts are seen as a sexual organ and not an organ for feeding the baby. Breastfeeding in public should be encouraged and not hidden. Despite several campaigns and efforts by health agencies, breastfeeding remains a taboo, but they are now creating many spaces for breastfeeding the children. Breastfeeding in the public should be entirely natural and it should be perceived as a right of every woman, and it is an investment for the nation who makes the health of the youngest members. Now, breast milk, as we all know, is best for brain development. So, formula milk should not be used. Formula milk is made up from cow's milk or buffalo's milk, which is good for their children, not for the humans. So this is very surprising that over 800,000 babies could be saved each year with optimal breastfeeding. So to summarize, we should all know that what is our role in promoting breastfeeding. We should counsel every pregnant woman about the breastfeeding, assess previous difficulties in breastfeeding experiences, identify high risk factors like diabetes, thyroid, obesity, previous breast surgeries, which is very, very common these days, and inverted nipples. Correct myths and misconceptions of the patients and encourage the family support. At the same time, baby friendly hospital initiatives should be taken so that every child enjoys breastfeeding and gets the advantage of it. It is a multidisciplinary teamwork where pediatricians, obstetricians, nurses, and family members are responsible for good and continuous breastfeeding. Use of non-judgmental language is very, very important to reinforce the confidence of the mother. And every obstetrician should be uh, actually advocating breastfeeding. So obstetrics does not end with the birth of the baby, but it begins with ensuring the best possible start of baby's life. Thank you so much.